I've been attending the Charing Cross Symposium for the last 24 years. As many of you will know, I've worked at Charing Cross with Professor Greenhalgh and have been involved in the organisation of the meeting over the last 15 to 16 years. We've seen the meeting expand from a meeting that had about 250, 300 delegates to 4,000 delegates, and we've seen it move from the Charing Cross site to the Imperial main campus and then to Olympia in the more recent years. Things I've personally learnt from it is the expanding knowledge that we as vascular specialists have, particularly in the fields of arterial and venous disease. Over the last 7 to 8 years, we've seen a significant rise in the number of venous presentations, the development of the venous office-based workshops, and also the clinical skills stations for aortic aneurysms and peripheral repair. This has increased the number of people who've undoubtedly attended, and all the many landmark trials that have influenced vascular surgery over many years are often presented as a first on the podium presentation, or there have been debates on those very important subjects to highlight some of the controversies as well as many of the consensus, and these have all helped to educate individuals attending the meeting. I think one of the things that is a personal thing, I always remember many years ago having a debate with Frank Veith, and we were having a debate on the use of PTFE grafts in lower limb revascularization. And I remember I lost the vote by about 92 to 8% the argument in favour of using PTFE grafts rather than using a vein graft. I think the one word I would probably choose would be excellent.